How's it going? This is Corolf, and welcome to this guide on diseases in RimWorld. Diseases in RimWorld fall into two main categories. You've got your lethal and your non-lethal diseases. The lethal diseases include the plague, malaria, the flu, sleeping sickness, blood rot, and infection. Then you've got your non-lethal diseases, which are gutworms, muscle parasites, paralytic abasia, fibrous mechanites, and sensory mechanites. You can tell if it's a lethal disease if there's an immunity progression counter as well as a disease progression counter. And basically, if immunity reaches 100% before the disease does, then the symptoms of the disease begin to wear off and your colonist is okay. If the disease reaches 100% first, they're dead. That's the end. So let's take a look at the lethal diseases first. We'll start with the plague. The plague is very fast progressing, causes extreme pain in the colonist, and weakens their consciousness and manipulation stats. The plague needs to be treated very quickly and regularly, with lots of bed rest. It can kill a colonist in less than 2 days if left untreated. It is possible to beat the plague with just herbal meds, but the colonist will need to be treated by a really good doctor, and an elderly patient would need to be treated by a great doctor. Next we have malaria, which is also fast progressing but a little slower than the plague. Its main symptoms are that it causes pain, lowered blood filtration, and vomiting. The issue with the blood filtration is that it gets progressively worse and impairs immunity gain, which makes it harder and harder for the colonist to fight off the disease. Treatment of malaria is similar to the plague. Having good meds and a good doctor is recommended. You can get by with herbal meds with a better than average doctor. The next disease we'll look at is sleeping sickness. Sleeping sickness is the only biome-specific disease. You can only contract it in jungle biomes. It's very slow progressing, causing mild pain, loss of consciousness, and tiredness, obviously as per the name. One of the tricks of sleeping sickness is with the loss of consciousness, be careful with any colonists on any drugs or medication that also reduce consciousness. If a colonist reaches 0% consciousness at any time for any reason, the colonist dies immediately. Sleeping sickness is not difficult to treat, but the colonist will spend a lot of time out of commission for a very long time as the immunity build is very slow. This is probably a good time for a little segue to talk about penicillin. So penicillin is a drug that makes a colonist immune to contracting the plague, malaria, and sleeping sickness. Notice that I said contracting, and only when penicillin is potent. Penicillin is potent for about 5.5 days from administration, so if you schedule your colonist to take penicillin every 5 days, that would be kind of the max safe time period between doses. Note that penicillin does not cure these diseases, and it does not have any effect on any of the other diseases. So if a colonist misses a dose, or for whatever reason contracts a disease, and then takes penicillin, it doesn't do anything for them. It doesn't help with their immunity speed, and it doesn't remove the disease. As I mentioned, it only works on the plague, malaria, and sleeping sickness, no other diseases. Something to keep in mind during a caravan is to make sure you send enough doses with them, or you can have a colonist contract something in between doses while on caravan. Okay, so back to the diseases. Next disease is the flu. It's not your one-day flu bug that you're all familiar with where you throw up a few times and then it's over. When it says your colonist has contracted the flu, it kind of means influenza, which is a lethal disease. I'm looking at you, COVID-19. The flu causes pain, weakens manipulation, vomiting, as you expect. It's generally not an issue for most colonists with proper treatment, being at least herbal meds and a decent doctor, as well as getting treatment when they need it. Blood rot is unique in that it's only part of the royalty DLC and only crops up as part of a quest. The disease causes minor decrease to blood pumping and filtration, vomiting, and a little bit of minor pain, nothing too drastic. The big issue is that it will be a constant drain on your medicine supplies, as treatment only slows progression but won't cure the disease. You can cure the disease with 10 Glitterworld meds according to Wiki, but I've never tried it. Blood rot will pass on its own eventually, but it will take a long time. I hope you've got a large stockpile of meds available. The last lethal disease is infection, which is caused by untreated burns, frostbite and bleeding wounds, and unsanitary conditions. Infection causes pain, reduces consciousness, and eventually as the disease progresses, loss of consciousness. Infection progresses quickly and needs to be treated right away. It can kill in only a day or so. Infection is the only disease where amputation of the infected body part will cure the disease. Of course, not everything can be amputated and the colonist will still live. So that gets the lethal diseases out of the way. Let's move on to the non-lethal ones. Interestingly, even though they're non-lethal, the biggest danger is mental breaks due to the pain, reduced sleep, reduced recreation time that comes with these diseases. So while they're not lethal in and of themselves, depending on what your colonists do, they could be lethal. The first disease we'll look at is gutworms, which causes hunger and vomiting, so they will tend to eat a lot and create a lot of mess, which reduces moods of everyone else looking at the, vomit everywhere. Curing gutworms requires medicine for each treatment and requires repeated treatments to purge the disease from their system. If you don't use meds and you don't treat on time, it will just keep going and going and going and won't go away on its own. The next non-lethal disease is muscle parasites, which causes pain, reduced movement, and tiredness. Like gutworms, it takes medicine and repeated treatments to remove it from the patient's system. The higher the quality of treatment the patient receives, the faster they will be cured. The second royalty DLC and quest-only disease is paralytic abasia. This disease causes almost complete paralysis in the patient. Moving is reduced to about 10%, and they can't really do anything. Treatment doesn't influence the disease at all, although similar to blood rot, if you have 10 Glitterworld meds you can burn, you can cure it. Paralytic abasia will eventually pass on its own, given enough time. Fibrous mechanites and sensory mechanites are similar and unique in that they actually improve the colonist in specific ways. Fibrous mechanites improve movement and manipulation, but also cause a lot of tiredness and pain. Whereas sensory mechanites, as you can likely guess from the name, improve sight, hearing, and talking, but also cause increased tiredness and pain in the colonist. Treatment reverses the disease's progression, and these diseases will eventually cure on their own, but don't hold your breath, it'll take a long time. Like I said before, the biggest danger with non-lethal diseases is that they will push your colonists over the edge and then they will start getting mental breaks, which, well, you know all about mental breaks. If you have a small colony, don't forget that doctors can self-tend. Just click on that little icon and they will take care of themselves. It's not quite as good as someone else tending them, but if you've only got one doctor, it's kinda all you can do. For a lot of diseases, there will be a time period that they can be tended, and then there will be a delay until they can be tended or treated again. There's also a small window where they can be treated and the effects of the previous treatment haven't worn off yet, but once they do wear off, you will get a notification colonist needs treatment, and depending upon the disease, you will really want to get on that right away because their immunity isn't getting any support and the disease is progressing at full speed again. I like to set my colonists to have a very high treatment priority as well as bed rest priority just to make sure they don't kill themselves running around doing their usual tasks and jobs throughout the day and not getting tended, and yeah, it's a very easy way to get a colonist killed. There are times when your colonists are sick, but you do need to get your colonists up and doing things, so make adjustments as your colony needs. One last thing to note is that animals can get diseases, but typically I find it isn't a big deal as long as you have someone that's taking care of them with herbal meds. They seem to pull through just fine. If you have any questions, leave a comment and I'll be sure to respond, but for now, thanks for watching. I hope you enjoyed. Take care.